in spite of what the screen says, I am not Dr. Kate Smith. I'm Tim Gibbs. And let me get this back to the beginning. Every once in a while, things just go sideways, and indeed it did. All right, so anyway, welcome to session 2 of Delaware Mini Medical School Fall South. I'm your host for this evening with Christy Hadley, and we'll run through the introductory slides. First off, these social media slides. The first ones are for either the Delaware Academy of Medicine and the Delaware Public Health Association or for Mini Medical School. And the last one in red is for the Sussex County Health Coalition, who is our partner for Mini Med South. So as I said last week about the program, the Academy was founded in 1930 and Mini Med has been running continuously since 2009. This year, Sussex County Health Coalition is our partner in Mini Medical School, and we're delighted for that partnership. This is part of the Delaware Health Force Initiative of the Delaware Academy of Medicine, Delaware Public Health Association, which is funded through the American Rescue Plan Act with funding through the U.S. Department of Treasury. And the idea here is to get you, students interested in a career in the health sciences, in medicine, in dentistry, and public health. There are no tests or grade. You found that out by now. This fall session will be the last session for this year, but we're already planning sessions that'll start early next year. For any of you adults online, there's no continuing education, no continuing medical education credit for this. If you're here, it's for your own edification, or hopefully some of you are parents joining with your kids. If you attend all 6 sessions live, then you get a signed certificate of achievement. If you attend less than 6, you do a self-signed certificate, and we'll explain more about that later. If any of you are Mini Med School North students who are making up for missing 1 or 2 sessions for Mini Med North, welcome back. We're glad to have you here. So why are we doing this program? Other than wanting to get you all interested in medicine and dentistry and nursing and in public health, we want to increase health literacy in our community, meaning your understanding of not only how the medical system works, the dental system, but also your body, how it works. We want to expose middle, junior, and high school and undergrad students to a range of topics and different types of speakers as a part of career goal setting. We're sharing career pathways with students to clarify how our speakers got to where they are today. And we're encouraging a dialogue between students and instructors in a safe setting where there's no personal issues that are the focus of discussion. You're not going to be getting an injection today for a flu shot or something like that, and you're not going to get bad news. This is about the Delaware Youth Medical Academy. I had promised last week that I would get an email out about this. Unfortunately, life didn't work out quite that way, but we'll try and do that over the Thanksgiving long holiday. Housekeeping tips. This is a Zoom webinar. You can't see each other. We can only see your names. And you can, of course, see our presenter. Only use the Q&A feature to ask your questions, please. Don't ask questions of a personal or family nature. This is a violation of privacy rights, and we have to take that very seriously. All questions will be addressed, some by staff, Christy and I, others will be selected for answer by the presenter at the end of their presentation. So we've asked all of our presenters to not entertain questions during the presentation. It really throws everyone off track. You do need to stay through the entire presentation, but once it's done and we're into Q&A, if you want to leave, that's fine. I will say, though, that some of the most interesting content comes out in the Q&A. This evening, we are on November the 21st, 2 days before Thanksgiving, from nurse to family nurse practitioner, helping communities navigate complicated health systems. Our presenter is Carrie Snyder, and I'm going to turn it over to Christy to go ahead and introduce this evening's speaker. Over to you, Christy.
Thanks, Tim. Greatly appreciate it. Carrie, thank you. We want to thank you for joining us tonight and to give your view on how you went from where you were to now. We're really looking forward to that. So, Carrie is a board certified family nurse practitioner and a women's health nurse navigator for BB Healthcare. Her nursing career has expanded over 20 years. She's worked in a variety of healthcare settings, as you can see. She received a bachelor's, a master's, and a doctorate in nursing, and she is board certified in ANCC or by ANCC as a family nurse practitioner. She has served as the chair for the health committee of the Sussex County Health Coalition. Shout out. Thank you, Carrie. We appreciate it. For over 5 years, she serves as a board member for Postpartum Support International Delaware chapter. She's a member of the PSI National chapter, the Delaware Nurse Practitioner Coalition, Sigma Theta Chi Honor Society, and the American Association of Nurse Practitioners. She was born and raised in Sussex County, and she resides in Millsboro with her husband and 2 children, ages 10 and 12. And again, Carrie, we really appreciate you being here, and we're going to turn it over to you.
Wonderful. Thank you, Christy. I am going to share my screen to get us started. Okay. Can you see my screen?
Yes, we can.
Okay, wonderful. Thank you. Let me just move some stuff around here so that I can see. All right. So we were having some technical difficulties. So I have 2 embedded videos that I wanted to be able to share as part of the presentation that I'm not going to be able to because we're not going to be able to hear the sound. So I can always send those clips out later. They're just short little clips that just add to the presentation, but we can work around that. I'm Carrie Snyder. I am a women's health nurse navigator for BB Healthcare, and I am a family nurse practitioner. And I am honored to be here today to talk to you about my journey in nursing and my career. So some objectives just to keep myself organized tonight. We already did our introduction. I'm going to describe what my journey in nursing looks like, provide an overview of nursing education, define what is a nurse practitioner, examine different career specialties for nurse practitioners, look at the scope of practice, and examine what that looks like for nurse practitioners specifically in Delaware. Examine the NP role in breaking down barriers to care. And if we still have some time before questions, I do have 2 case studies that we can go through. So as in my introduction, I was born and raised in Sussex County, Delaware. I grew up on a chicken farm. I graduated from Indian River High School in 2000. And I grew up in a household where it really wasn't a question of whether I was going to go to college. It was more of, where are you going to go to college? My dad was a farmer. No one in his family ever went to college, but it was still really important to him that my sister and I went to college and furthered our degree. So I started at the University of Delaware, and I originally started as a pre-med biology major. I honestly had wanted to be a pediatrician from the time I was little. If you look back in all of the, memory books that my mom has, everything says, oh, I want to be a baby doctor or a pediatrician. And so there was really no question that was what I was going to do until I got to college. And then I realized that I hated my classes. I was not enjoying the classes I was taking, and I was really confused. I had thought I knew exactly what path I wanted to be on. And then here I am as a freshman thinking, like, what am I going to do now? And I actually got exposed to nursing because I had a friend that lived in my dorm who was a nursing major. And I was so jealous because she got to do all of these fun things with freshman year. Like she got to go visit patients at the nursing home. She got to go work at these community health fairs. And I was like, why don't I get to do that as a pre-med major? Why should, I want to do that. That sounds like a lot more fun. So I switched my major to nursing following my freshman year. So I started as a sophomore, and I really, really, really enjoyed the nursing program. Sometimes we think we want to be in a certain area, and then we get experiences, and then we realize maybe that isn't exactly what we want to do. And I found that even as I progressed through the nursing program, during your clinical kind of senior clinical rotation, you have to pick a concentration. And I thought I wanted to be in the operating room, the pediatric operating room. And I started that and I was like, whoa, this isn't for me. And switched to the PICU, the pediatric ICU, and really loved it and learned a lot. So in 2004, I graduated with my bachelor's. And so then I started interviewing for graduate nurse jobs. And one thing I can say about my nursing program at University of Delaware is that they really taught us and prepared us for that job interview piece. And that it wasn't just that we were going in and being interviewed as an employee. We were interviewing the job. Was it a good fit for us? Was it something that we felt we could see ourselves doing? Did we feel like we were going to be supported as new nurses? Did they offer education for new nurses? What did the orientation look like? And so I was really looking at that point for a position that allowed me to be part of an internship. Which is common, more common, I think, now than it was when I first started. But with an internship, you are working, you're getting paid to work, but you're also in a learning environment. So I accepted a position at BB Healthcare as an ICU nurse, and they had a graduate nurse internship. And this internship, we would meet, once a week, sometimes every other week. And go over certain skills that maybe you didn't get a lot of experience in during your nursing program. Things like putting in NG tubes or catheters or EKG readings. As a ICU nurse, you're in there learning how to read EKGs and being able to run a code if needed. So the internship really allowed us to focus on kind of specific skills and grow those skills. And so within a year, and this is a common occurrence that I hear from a lot of new nurses, within a year, I was a charge nurse on the unit. And so it's really quick how fast you learn and progress in your role in nursing. I remember being on orientation and orientation ending and going to my manager saying, I don't think I'm ready. I'm not ready to be by myself. I don't think I can do this. And she's like, you are ready. You are ready. And you're never alone. We're all here and you'll be supported. So it was a really, really great experience as a new nurse. And so then I decided to start graduate school. Why not, right? I didn't have kids. I wasn't married yet. And I was like, you know what? Let's just go back to school. And at that point, it was really, I was trying to decide between nurse anesthetist school and family nurse practitioner school. As an ICU nurse, many people went the role of nurse anesthetist school. And so I had another colleague who was starting CRNA school at the same time. And I decided to go the family nurse practitioner route. I really enjoyed the focus on prevention. And I really wanted to be working in a community setting, not always in a hospital-based type of care provider. So I started at Wilmington University, and it's about a 2.5 to 3 year program. When I was going through the program, the graduating class, I think, was 5. There was 5 of us that graduated. Now the classes are much bigger, but there were 5 or 6 of us. So I passed my boards, which was super exciting. And then I started working in a primary care setting. I actually went and was offered a job and took a job with one of my clinical preceptors. And that's one thing when you are going through nursing school or nurse practitioner school, that you make connections and relationships with the people that you are learning from. And I had a wonderful clinical instructor who is a family physician, and I learned so much. And at the end of my clinical rotation, I was offered a job. And so it was really a great transition from, being a student to then really being a independent family nurse practitioner, but also being in an environment where I felt I was supported, and someone who was still willing to teach. Because just because you graduate doesn't mean you're ready to be 100% on your own without support. You definitely want to be in an environment where you have some collaboration with other healthcare providers. So since then, I've been an RN for 19 years and an FNP for 16 years, almost 20 years as an RN, almost. And still learning. So I actually just finished my doctorate at Georgetown University in May, and did my doctorate dissertation on perinatal mental health and mental health literacy. So switching gears a little bit, and not so much on my specific journey, but really looking overall at nursing education. So how does someone become a registered nurse? How does someone become a nurse practitioner? And there are really different ways to do each of those. And it gets a little bit confusing. And I think it's confusing sometimes for patients in the community. And they don't really understand sometimes of what our backgrounds are and what kind of education we have. So as far as being a registered nurse, there are 3 different ways you can become a registered nurse. You can attend a diploma program, and that would be something like the BB School of Nursing. You can attend an associate program, which would be like Deltec's nursing program. And then there's a bachelor's program, which is like the University of Delaware's program. And so the diploma and the associates usually are around 2 years, sometimes more based on clinical time that you have. And then a bachelor's program is usually about 4 years. Regardless of which route you take, you want to make sure that you are attending an accredited program. If you are not attending an accredited program, you will not be eligible to sit for the boards. That is really important. And there have been some instances recently where people have been thinking they're graduating from a program that's accredited, and then they have sat for the boards, and then the Board of Nursing has had to revoke their license. So it's really important to make sure you look into that, of what the program is and that it's accredited. Once you complete any of those 3 programs, you would be eligible to sit for your RN boards. And so you're considered a graduate nurse after you first graduate from the program. And then once you pass your boards, you would be a registered nurse. Moving on to becoming a nurse practitioner, you have to have a bachelor's degree to start into a true nurse practitioner program. It does not have to be a bachelor's in nursing. It could be a bachelor's in anything. It could be a bachelor's in public health or a bachelor's in accounting. It could be anything, but you need that bachelor's piece before you can really move on to start taking master's classes. There are many bridge programs now, though. There are RN to BSN, RN to MSN. There are even RN to DNP. So you kind of just go through and some of the classes are combined, and you don't necessarily have to take as many individual classes to meet the requirements for each degree. Nurse practitioner programs are typically MSN or DNP at graduation. So you'll graduate with either a master's or a doctorate. And the goal when I graduated in 2008 was, I believe it was the goal for 5 years was that all nurse practitioner programs would be entry-level doctorate programs. But that takes a really long time to be able to get all of those programs on board to be able to provide the requirements to be a doctorate program. So we're not there yet. There's still many, many, many master's level nurse practitioner programs. And then, of course, once you finish your program, you have to pass your nurse practitioner boards and become board certified. So we're going to skip that. This was a video just kind of really kind of going through what a nurse practitioner is and defining it. And this guy's kind of funny when he goes through the education requirements. So I'm going to skip that. Okay. So nurse practitioners are licensed by their state board of nursing. They're nationally certified. Depending on your specialty area, there are different credentialing places where you will take your boards. So family nurse practitioners versus acute care nurse practitioners or palliative care nurse practitioners. There's different certifications for those. We have to recertify every 5 years, and there are certain requirements for continuing education that have to be done in order to renew. We also have to keep our Delaware nursing license along with a nurse practitioner license. So we have 2 licenses that we hold in the state. So one really cool thing about nurse practitioner is that there are so many different areas that you can focus on. You know, when I went to school, the only program in Delaware was a family nurse practitioner program or adult. And now there's a psych NP program and there's a pediatric nurse practitioner program. And there are just so many different areas that you could focus on. You know, I feel great with having that family practice background because it encompasses kind of the whole continuum of care from infants to geriatric patients. But, you know, if you are someone that really knows that you have a niche working with a certain population, you can attend a program where you really just hone in on focus on that. So these are all areas that we see nurse practitioners, of course, primary care, internal medicine, pediatrics, neonatal. I work with some amazing neonatal nurse practitioners at BB who take care of all of our babies and are there 24 hours a day in our labor and delivery setting. We have hospitalists. We have quite a few of those at our healthcare center. Urgent care, of course, educators, professors, acute care, aesthetics is a really big new area of interest for nurse practitioners. I've seen quite a few opening practices for different types of skincare or Botox or other types of aesthetic treatments. Dermatology, cardiology, women's health, orthopedics, nephrology, urology, psych, pain management, palliative care, school-based health centers, employee health or occupational health, business owners opening their own businesses, entrepreneurs, population health, trauma, ER, leadership. I mean, the list goes on and on and on. So nurse practitioners, when you look at the scope of practice, it varies depending on the state that you live in. And it's really interesting when you, as a nurse practitioner, when you attend conferences with nurse practitioners from other states and you hear the differences in what they're allowed to do versus what you're allowed to do in your own state. So scope of practice defines the procedures, actions, and processes that a healthcare practitioner is permitted to perform. In Delaware, we are a full practice authority state. So we have maximum authority. We can practice at the highest level of our nurse practitioner license. And we are so blessed to be able to do that. A lot of my colleagues that I attended my doctorate program with or that are in restricted states, it can be really, really difficult sometimes to be able to provide the best care when there are such stipulations on their practice. So if you look at this map, anything that's in this light blue is going to be a full practice state. So, you know, we're great here in this little like Maryland, Virginia, Delaware and North, but there's still quite a few states that have restrictive nurse practitioner licenses. actually, I'm going to go back to this one too. And full practice authority for the Delaware Code looks at it, meaning that APRNs are allowed to evaluate the patients. They can diagnose, order and interpret, test, initiate and manage treatments, prescribe medications, and they can open their own practice. After they do not have to have a collaborating physician. And this is a newer change to the law in Delaware. And you're starting to see more nurse practitioner owned practices open, which is really exciting for our, really for nurses and for healthcare in general, just the increase in access to care. So more on scope of practice. We diagnose and we manage both acute and chronic conditions. So we can see patients for just those quick things like, oh, I've, sprained my ankle, or I think I have a urinary tract infection, or I'm having this symptom. It just started yesterday. But we also see patients for chronic conditions like COPD and diabetes and heart disease and cancer. So there are just really across the whole continuum of health. We do prevention. We do a lot of education and disease prevention, health promotion. And that's one thing I think that really sets nurse practitioners apart in our healthcare field is the emphasis we put on that health promotion piece. That comes from our nursing background. Common responsibilities: ordering, conducting, supervising, and interpreting diagnostic studies, and prescribing both pharmacologic and non-pharmacologic therapies. So my career as a family nurse practitioner, so being as a family nurse practitioner for 15 years, almost 16 years, I have been able to work in a lot of different settings and take care of a lot of different types of patients. And so the beginning of my career was really focused on primary care for adults, and also primary care in a pediatric setting. So I did a lot of well checks for kids, a lot of vaccinations. I did a lot of managing hypertension, diabetes, Medicare wellness exams, well woman exams. My first family practice role, I worked in the family practice office with two physicians, and we had a great relationship. We collaborated. I always felt like I could ask questions to them, and then they would ask questions to me. I mean, they would be waiting on outside of the door. I was seeing a patient. They would come and be like, Carrie, can you come look at this skin thing? I haven't seen it. Like, I don't know if you've seen it before. And it was really cool to have kind of colleagues that you can bounce ideas off of each other, and that work in that kind of collaborative environment. After I left family practice, I spent a few years in a school-based wellness center, and that was a really great experience also. I love adolescents. I love that age group of kids, and some really interesting things in the wellness centers. Did a lot of sports physicals, a lot of reproductive health. We were lucky to get reproductive health passed at the wellness center that I worked at. So we were able to provide pregnancy tests and birth control and different other types of contraception while we were there. I've worked in walk-in clinics. I've been a clinical preceptor for nurse practitioner programs. And then I returned back to primary care. Primary care has changed a lot in the last 10 to 15 years, and a lot of the private practices are now part of healthcare systems or larger hospitals. And so I returned to primary care and returned to BB. And while back in primary care, my current role became available. It was really a different type of role, very innovative, kind of grassroots. Was kind of these two directors at BB decided, you know what, we really need someone that can help break down the barriers for our patients. We need somebody that can help collaborate between the hospital, the outside agencies, our outpatient centers, the community organizations, but we need somebody that has an advanced practice nursing degree, somebody that has the experience, somebody that can really recognize what it is that these patients need. And that's where kind of what led me into my role now, which is I am the advanced practice registered nurse navigator for all the service lines. Now, I've been in this role for 6 years. It's a very unique and different role than many other nurse practitioners. I feel like all of the things that I've done as a nurse practitioner for the last, 10 years prior to this role kind of led up to being able to do this role, because I've learned so many bits and pieces along the way in how to break down some of the barriers in healthcare and what is it that causes patients not to be able to be compliant with their prescriptions or their treatments, and what is it that we need to do as healthcare providers to help and to make it easier to really be healthy. So nurse navigators or navigators in general are patient advocates who ensure that each person receives the highest standard of care from the first consultation and throughout the patient's plan of care. And you'll see the word navigator used, but you'll also see things such as care coordinator, care manager, settings in population health, community health, public health, oncology. The navigator really, I think navigators really started in the oncology field with people who had received new cancer diagnoses and didn't know what to do. How do they get from that, oh my gosh, I've had a positive, mammogram, to now I'm having a biopsy, now I'm having, surgery, now I'm meeting with an oncologist. Like, there are all these pieces to that puzzle, and somebody that really just helps to walk that patient through the process and make sure that they can break down any barriers that come up. So not all healthcare navigators are advanced practice nurses. There's even navigators in certain healthcare industries that aren't nurses at all. They may be what we call lay navigators. So they may be more community navigators. They may be somebody that's just really embedded in the culture of a certain population. And so in the end, regardless of education, we all have really similar goals, and that's to break down the barriers to care, address social determinants of health, and increase healthcare access for patients. So part of what I do, being the service line nurse navigator, I am available to answer questions and triage patients for really any of the service lines. So cardiology, orthopedics, women's health, or surgery. So patients can reach out to me on our website. There's these contact forms. I have multiple email addresses that all get funneled into one email address, multiple phone numbers that get funneled into one phone number. And really, patients can reach out with any type of question. There's a piece of this that we kind of say is like concierge medicine. So, somebody has a question and then they can reach out and get a little bit of personalized direction on what to do. A lot of what I do is help kind of break down barriers into access. So people who can't get appointments, people who are really struggling to find the right type of provider for the specific problem that they're having. And being that liaison between the community and the hospital. So the hospital doesn't provide all the services that patients need. And so we need to know what else is available, right? What are the community organizations that are offering these services, and how do we get our patients connected to those community organizations or those community providers to make sure that they get all of the services that they need. Another piece of what I do, and I really spend a lot of my time in women's health. That's kind of my my favorite area, I guess, and probably where we noticed the biggest need as I've been in this role. And so I receive referrals from providers with patients who during pregnancy, whether during the prenatal period or during that postpartum year, need extra support. So that may be mental health support, that may be patients that have substance use disorder problems and need help getting connected to treatment, and then really just need some help working through some of those social determinants during their or after their pregnancy. We also work with identifying gaps in care. So sometimes I'll be getting a lot of phone calls about something specific. I'm like, man, we need to figure out how we can incorporate this into our healthcare system. Or one thing that we noticed with the mental health was when I started was that there is such a lack of therapists that specialize in pregnant and postpartum women. And so there's a niche for that, and there's certification for that, and there's education for that. And so, recognizing that we need more of those services in our area, especially for me in Sussex County, looking at what our community needs, what are the gaps in care, and then being an advocate for our patients. So really just, helping them, supporting them, making sure they don't give up in the process of trying to get the appointment that they need. So social determinants of health is a lot of what I do. So, social determinants of health are things that we are born, we grow, we age, and it's where we live, where we work. And they all directly affect our health and our well-being. So these are our childhood experiences, our housing situations, the communities that we live in, our income, our education, our employment, our access. So, how far do we have to drive to get to the doctor? How far do we have to drive to get to the hospital? How far do we have to go to get to a lab to draw blood? And then, what kind of supports do we have? Do we live alone? Do we have family? Do we have anyone that we can call and depend on to help us if we need it? This was another video, and this was a really cool one, actually. It talks about two different women who live in the same town. They received the same notice from public health stating that they were due for their cervical screening. So they were due for a pap smear to check for cervical cancer. Rebecca is a lawyer. She has support. She's married. She has people to depend on. She has transportation, and so she received her the letter stating she was due for a screening. She called. She made an appointment. She went. She had it, and she did that for 5 years. Every year, she went and had her appointment. Charlotte is a single mom. She's got 3 children. She works 2 jobs. She doesn't have any family in the area. She doesn't have any support. Her car is unreliable. It's in the shop half the time. She gets the same notice. She decides to wait. She says, you know what? I can't take off work right now. I can't make this appointment. I'll wait till next year. And so she does that for 5 years. And 5 years, Rebecca goes in and finds out she has cervical cancer, but it's found early. She receives immediate treatment, and she does great. Charlotte, who doesn't have any screenings done, goes in 5 years with bleeding and pelvic pain and ends up having metastatic cancer that is spread throughout her entire body because she wasn't able to get early treatment. And so 2 women living in the same place, but due to the social determinants, the stresses in their life, receive very different care. And it just paints a really good picture of what that looks like. And what we are trying to do is help a Charlotte and figure out how we can break down some of those barriers to make sure she's getting just as good of care and just as quick of care as Rebecca is. So back to barriers to care, only 20% of our health is really related to healthcare. It's that 50% that's related to those socioeconomic factors and our environment. So that's our education, job, family supports, income, and then of course there's the fact that our zip code actually sometimes can have a direct effect on our health and ability to be healthy. And so we see certain zip codes being such areas of early mortality or high cancer rates, or just really, really unhealthy. So how can NPs, nurse practitioners, help decrease these barriers to care? So collaboration is huge and number one, and that is what I spend a lot of my time doing. And this slide just has a ton of different community organizations and different things that I collaborate with on a, sometimes on a daily, weekly, monthly basis. Sussex County Health Coalition being one. It is a great resource to be able to tap into the health committee or the behavioral health committee and hear speakers, learn about new providers in the area, learn about new programs in the area. And I always know I can reach out to any of the people at the Health Coalition by email and say, hey, I'm looking for this. Do you have a contact? Do you know somebody who's providing this service? And they always get back to me, and I usually am able to get my patients connected pretty quickly. So it's an awesome resource. But all of these, Delaware Health and Social Services, I use like the Catholic Charities. They will pay people's bills often. They'll help them with their mortgages if there's a situation to try to get them through. Children's and Families First does amazing things. They do home visiting programs for new moms. There's a lot of treatment programs. Delaware First Health and AmeriHealth, those are insurance companies, and they provide some great care coordination just within those actual insurance companies. Their patients will qualify for a lot of extra benefits. So collaboration, you don't have to reinvent the wheel. You just need to know what's out there, and your patients need to know how to connect to those resources. When I was a family NP in the office doing primary care, there were so many programs I didn't know anything about. And it's tough because I think there's a lot of providers that are seeing patients in the office that don't always know the great programs we have. And it's people like me in this navigator role who help connect the dots and the pieces to it, because we all can't know everything. But if we have good contacts and we know that, oh, I bet there's a program out there, let me see who I can call and find out more. Collaboration is the key. And that is one thing I think we do pretty good in Delaware is overall collaborate as healthcare systems. Another thing is identifying the gaps in care. And that's something I mentioned earlier was when I started in this role, looking at the lack of perinatal mental health providers. And I actually attended some trainings and became certified as a peri-mental health provider. And it's given me so many more tools in my toolbox to work with, moms who are experiencing these conditions, and being part of a lot of advocacy work in our state to increase the number of providers and the education for providers. Another thing is sitting on the Maternal Mortality Review Committee and the Fetal Infant Mortality Review Committee. We're looking at these cases and determining what we can do different, what we can do better. Could we have prevented? Could this death have been prevented? And so looking at those and really recognizing if there were gaps in care and making recommendations on how to make improvements from year to year. Another piece and something NPs can do is advocate for their patients. So treat their patients with respect, listen. I remember my preceptor, one of the collaborating physicians I had, he said, you will learn more about your patient, and 90% of your diagnosis will be made on listening to your patient versus touching your patient. So there's a lot you get from your clinical exam, but there's so much more that you get when you listen to your patient and you listen to them and you don't interrupt them and you allow them to tell you what they're experiencing. Communicating with patients' families, communicating with the healthcare team, collaborating with other healthcare providers, mediating conversations between multiple providers, honoring patients' wishes. And something that was really interesting that I learned during my doctorate program was looking at person-centered care versus patient-centered care. We always say, oh, patient-centered care, but patient seems a lot less personal than when we say person-centered care, because it's not just about an illness, right? They're not just a patient. They're not just a disease. They're not just their diabetes or their hypertension. They are a person, and that person has social needs. That person has mental health needs, and that person has medical needs, healthcare needs. And so I love that person-centered care and really looking at kind of changing how we think about our patients to being people and not just patients. All right. How am I on time, Christy?
You're doing good.
Okay. All right.
All right, I couldn't get off mute.
I just have two pretty quick case studies I just want to run through with you guys. It's more about it's two typical patients that I would talk to and take care of in my daily role as the navigator. So the first one, AC is a 27-year-old female who is pregnant with her second child. She presents to the ER with her sister complaining of vaginal bleeding and abdominal cramping. She reports she fell down the stairs earlier in the day. She has not started her prenatal care yet, but thinks she is probably in her second trimester. She lives with her boyfriend, who is also the father of her two children. She does not have custody of her other child. He resides with the maternal grandmother. She has an ultrasound in the ER showing a viable 28-week fetus with no abnormalities and no signs of preterm labor. The patient is transferred to labor and delivery for monitoring. During the nurse's exam, she notices bruising on the patient consistent with handprints on her shoulders and upper arms. The nurse reports her findings to the OBGYN, and the hospital case management and the nurse navigator are consulted. So this would be a typical patient that I would be called in on because there's obviously a lot of social things going on here. You've got someone who's pregnant with their second child, doesn't have custody of their first child. And so there's a question of why don't they have that child, and are they going to be able to take care of this child? You've got a kind of traumatic event where a fall occurs, but you've also got some signs and symptoms of abuse. And so red flags for domestic violence. And so we would need to make sure that we could tease out that and talk to the patient and see, if there's concerns for domestic violence and if we can provide some resources for that. The other piece is transportation. Her sister brings her in. Does she have her own transportation? She lives with this boyfriend. If this is domestic violence, does she have a safe place to live? And if she doesn't have a safe place to live, how can we help her find somewhere to live that she'll be able to take, that she'll be safe and be able to take her baby? So this is definitely a common thing that we see, and can be really, really stressful for the patient who is also pregnant and trying to take care of their health and hasn't been able to really start prenatal care. And so we kind of intervene and try to do what we can to break down some of those barriers and make sure they're connected to all the resources. Second case study. DS is a 48-year-old female who is 6 weeks post-op from total hysterectomy, complicated by acute kidney failure immediately following surgery, which required an extended 10-day hospitalization. The patient was diagnosed with uncontrolled diabetes type 2 with a hemoglobin A1C of 13 and required insulin management while in the hospital. After discharge from the hospital, she developed a foot infection that required wound care management and surgical debridement. She presents to the GYN office for a follow-up appointment from the hysterectomy and is extremely tearful. She is worried about losing her house because she has been out of work. She cannot pay her mortgage or bills. She can only afford to eat from the McDonald's value menu, and she knows that this isn't helping her newly diagnosed diabetes. She is also having a difficult time affording her medications, including the insulin. She's not been able to get in to see an endocrinologist yet, and her blood sugars are still running over 200 most days. The wound on her foot is still painful, but she's run out of wound care supplies. She is feeling very depressed and doesn't know what to do or where to turn. And this is another very, very common type of patient that we would see who has so many stresses, and they can't address their diabetes. They can't heal their foot. They can't take care of those things when they don't have food to eat. They don't have transportation. They can't afford their medications. And so as a provider, it's breaking down those things and understanding that we really have to start with the things that are most important. And we've got to make sure that they have food to eat, a safe place to live, a clean environment, the supplies they need, and really just kind of peeling all those layers back and seeing how we can help. It can be really, really complicated and really difficult sometimes. And but I have to say, this is a patient that we've had before, and there are so many great programs out there, and just getting them connected to different things that will help with financial supports for a period of time, and getting medical supplies. And there are a lot of things that will help with drug costs. And so those programs are out there. It's just making sure that you can access them. All right, so that's the end of my presentation, but I'm happy to answer any questions.
All right, hold on for a second here. Let me get back.
Stop sharing here. Yeah.
All right, there we go. Yes, there are some questions, and I'm sure more will come in. Is it mandatory for the police to be called if there is a sign of domestic violence?
So, no, it would not be mandatory for an adult. If it was a child and there was a concern for abuse or neglect, that's a reportable offense. But that is going to be because the patient is an adult. That would be a question and a discussion with the patient of whether she wanted the police to be called. Sometimes something just like calling the police for a victim of domestic violence puts them at a higher risk of death. So you really have to be very careful, and it's a discussion with that patient and making sure how to keep them the safest you can.
Right. Oh, I found, by the way, how to become a nurse practitioner, and maybe if we get through questions, I can try and queue that up on my side. Okay, let's see. There have been a lot of questions, Carrie, which defer entirely to you on your comfort with addressing this. A lot of questions about how much did it cost for you to go to school? How much was your debt when you came out? If you feel comfortable talking about that, the class has a lot of questions. I've been referring them in the Q&A to, various internet sources which talk about averages. So yeah, I leave that at your discretion.
So I think, so I personally, just a kind of an overview, when my decision when I started my undergraduate degree to go to University of Delaware was because I received a scholarship. And so I wanted to attend another university out of state, but when I really weighed the pros and cons, it wasn't worth coming out of my bachelor's with debt. So I didn't come out with any debt for my bachelor's. So it made it a little bit easier to start into a master's program when I didn't already have a ton of debt. But there are so many programs available to really help support healthcare cost for school now. And so I encourage you to look into what we have in the state of Delaware, what programs are available, what's available in other states. Often if you can, if you go to school to be a nurse and you're going to come back to the community that you live in, or an underserved community, and provide care, often a lot of it can be reimbursed. Another thing is when you start a master's level, if you have a full-time job, most hospitals provide some tuition reimbursement. And so I took advantage of all, BB offers tuition reimbursement. It didn't cover everything, but it helps.
Right.
And so that's another thing to look at in the job when you're interviewing your jobs and say, do you provide tuition reimbursement? Because I really want to continue on and get a master's or a doctorate. And I want to be somewhere where I'm going to be supported in that.
Right. And just to do a shameless plug for one of our programs, we also provide interest-free financing for Delaware residents going to Delaware schools who are willing to come back and practice in their community or someplace in Delaware. So for those of you seniors who are thinking about starting into school, drop me a line. Let's see, two more clinical one. What is a hysterectomy and what is an endocrinologist?
Those are great questions.
And go.
So a hysterectomy is going to be removal of the female organs. So it's going to be the uterus that's removed. Sometimes that includes the fallopian tubes and the ovaries and the cervix, but not always. But usually it's always the uterus, and that's done for a variety of reasons. It could be due to bleeding or endometriosis or cancer, precancer cells, lots of different reasons it might be done. The endocrinologist is a provider, a physician. An endocrinologist is a physician who specializes in the endocrine system. And so that would be a provider who takes care of diabetes, thyroid disorders, other things that are just really affected of it's a specialist. So it's kind of like a cardiologist who deals with the heart. An endocrinologist deals with the endocrine system.
Okay, Anna and Alyssa both asked basically the same question. What are the differences in education and practice between PAs, physician assistants, and nurse practitioners? And go.
I knew I would get this question. This is a really common question. So I would say the biggest difference is that nurse practitioners are nurses first. To be a physician assistant, you usually go on to a physician assistant program. Sometimes that's a bachelor's to master's program, but there's not a prerequisite of being a nurse first or a pre-med something first. So it's a physician's assistant program. Nurse practitioners go to a nursing program first. The other difference is that we kind of are governed by different bodies. So nurse practitioners fall under the Board of Nursing, whereas physician's assistants usually fall under the Academy of Medicine. There are also different rules in different states depending on where you live, on what PAs can do versus NPs can do. It depends on your state, but we work together all the time. We work very, very similar in Delaware. I have tons of PA colleagues.
Right, and one of the other areas of compare and contrast is on working independently from physician oversight, which is still complicated. Yeah, it's complicated.
Yes, and that's very complicated too, because it also can depend on who you work for. So a lot of hospital systems, even though in Delaware as a nurse practitioner I can be an independent provider, in a hospital system that doesn't mean the same thing. And so there's a lot of different rules, and
right.
It's all meant to keep patients safe. That's really how we look at it.
So let's see. So here's a good one. What are involved and what are RN boards and NP boards and physician boards? What are boards? Explain that to us.
It is like a really, really, really big final exam that you have worked for. You have learned all of these things over these years of attending a nursing program. And then at the end, you have to take a really big test. And you don't know what's going to be on that test. There are thousands of questions that could be on that test. And so for both my RN boards and my nurse practitioner boards, I took review class, and I studied. And one thing is once you, now this is different for different places, but once you take those boards, as long as you renew your license and do your continuing education, you don't have to take that big test again. So you have to make sure you do all of those things on time and don't let them lapse.
Right. So Aisha asks, how many years in total does it take to become an NP?
So once again, that can look different depending on the program that you go through. For me, I did a 4-year bachelor's degree program. And then I did a master's degree nurse practitioner program, which was about 2.5. It was like a fall to winter, like a 2.5 years. So that would have been, let's say 6.5, 7 years. And then I just recently got my doctorate. It doesn't add anything to being a nurse practitioner. It was just something I, personally wanted to do, wanting a terminal degree in nursing. And so that was another two years. So, well, 2.5. So it's, I would say about 10 years of school.
All right. And I hope I'm saying this name right. Tamar Lewis wants to know, how hard is NP school, and have you found it to be worth it?
So NP school was challenging, but interesting also. So when you're learning about things that you're really interested in, and I think that's the difference in college and in grad, so even undergrad versus graduate school. When you're learning about things that you are interested in, you're wanting to learn more, you're reading articles, you are engaged in a different way than when you're taking a class that you don't care about. And even when you do your undergraduate, sometimes you have to take those classes that you are like, oh, I'm never going to use this. I don't care about it. It's just not as interesting. So I found nurse practitioner school to be really, really interesting. I think the most difficult part of graduate school is time management and understanding that you've got to balance sometimes, you have a lot of things on your plate depending on where you are. And that may be, you've got a lot of bills, you've got to work, you've got a full-time job, you may be married, you may have kids. And so just balancing all of those pieces is probably the most difficult part. The other part is just, putting the time and studying and learning and asking questions. Always ask questions.
Yeah, and I would add to that from my perspective that the older you get, later, mid-career education or subsequent education gets easier because usually you really want to do it. And it trust me, y'all, it changes over the more you age, your perspective on education changes. And frankly, for me, it's gotten a lot more fun. So when I get another degree, it's because I really am enjoying it. Is it work? Yeah, absolutely. But it's because it's something I'm interested in. So here's like a great question. Allison, thank you. What are some of the struggles of being a nurse practitioner?
Well, I think being in a giving, caring for people field is challenging in general. I think healthcare, we're seeing that there's a very, very high burnout rate for all of our colleagues in healthcare. There are those barriers to care, the barriers that patients are dealing with. Those are really frustrating as a provider, as a nurse practitioner, when you're trying to provide good care and you know what this patient needs. They need this medicine, they need that, they need to do this. And you can't get all of those things aligned because of all the other problems that are going on in the patient's life. And so that can be really frustrating and challenging. That's probably one of the biggest ones. I would say every nurse practitioner, depending on the area that they specialize, has a unique things that are more frustrating or difficult. Probably for me, I struggle with the processes that are in place and think to myself, we could do this so much better and so much quicker. And why are there 25 million hoops for this one thing to occur? So I get frustrated sometimes with just the amount of processes that we have to get through to get patients what they need.
All right. Hey, can being a nurse practitioner make you rich?
Well, no. I mean, I guess it can. I think there are some entrepreneurs and people on TikTok who are making some pretty big money doing some interesting things as nurse practitioners. But you can make a really great living being a nurse practitioner. There are so many areas that you can go into, and if it's about the money, there are ways to make big money. It really depends on what your interests are.
Right. I'm just looking at these questions coming in. Boy, folks, we can't ask her how much she works. Not appropriate questions. Sorry. I posted in the webinar chat a link to nursingworld.org, which is one of the resources that I've seen before about nursing career pathways. Chris Odo, who's the executive director of the Delaware Nurses Association, uses this a lot. So, you know, as Carrie said, there are a lot of pathways. Nursing, far more than any other type of healthcare provider, has a lot of different ways to get to the destination. And one of the questions that somebody asked earlier that I answered online was, you know, could you conceivably be a nurse and get up to an NP and then say, you know what, I want to be a doctor? And the answer is yes. And I know people who have done that. I think that the thing that to reflect on is that's committing to almost your whole adult life being in school. That's a major pathway. But getting back to the beginning of the pathway, what do you think about being a CNA before an RN, or CNA, LPN, RN?
Yeah, so I think you know, being a CNA is a great way to kind of get your feet wet and see if healthcare is something that you're interested in. It's also something that you can do and work during your nursing program. So you can make some pretty good money working as a CNA part-time while you're in a nursing program, and you're getting great experience. And we have many, you know, CNAs who are in nursing school, and they're the best ones because they want to learn and they really are interested in what they're doing. You know, for me, it wasn't my path because I graduated high school and I was planning on going to a bachelor's program. I was really planning to go and be a doctor. That was what I had thought I wanted to do. And going back to that question of could you go back on to do that? Like for me, once I became a nurse, it was never a question of wanting to go be a medical doctor. I wanted to get a doctorate, and I have. That was a goal of mine, but it's just a different path and a different way. And you know, I appreciate my physician colleagues. And I love nursing and then kind of what we're about and what we stand for. And I'm, happy with my career choices.
Right. Have you done any overseas programs at this point?
I haven't. And that's one thing I do regret. And I would, if I could go back and do it again, I would have studied abroad with the nursing program at University of Delaware while I was there. I really wish I had done that, but it was expensive. Right. That was why I didn't do it, but that's a great opportunity if you can do it.
Christine, do you want to grab any of these questions? You've probably got some that you'd like to ask.
Sure. How is the work-life balance? It seems like it would be a very stressful job.
So, many of my career moves, changes of jobs have been based upon the work-life balance and what was going on in my personal life and where I needed to put those priorities. And so being in primary care and family practice was very stressful. And it was, I didn't have a lot of flexibility in my day. And so because you've got, patients scheduled, and you can't, if your kid is sick, you can't necessarily just leave, because then you're canceling everyone's appointments. So for me, I left primary care and went to the school-based wellness centers when I had my babies, like when I had little ones. And so that was a great job. I worked more of a teacher schedule. And I had holidays off and weekends off, and summers off. Now I needed to make more income in order to kind of, be where I needed to be. And so that's when I would do per diem jobs at like a walk-in clinic. And that was great because that was really good money. Per diem per hour money is great. And I could work extra when I wanted to make more money, but I could also be home with my kids when I needed to be. And then, as I've progressed in my career and worked towards where I am now, I have more flexibility. And so I feel like I'm able to work and balance it all. I think you also just get better at it. I don't know, like you're more confident in your decisions, you're quicker in your decisions. And so, overall, I feel the majority of the time I have a pretty good balance. There are times that I'm more stressed at work than I'd like to be. But there's times I'm more stressed at home than I'd like to be. So it's just a balance. And I think if you find yourself in a place where you're overwhelmed and feeling like you're not being supported at your job, and then it's time to make a change. And that's the great thing with nursing, is there's so many different places you can go, different things you can do. So there's always, an alternative to kind of what schedule you have.
Great. I like this question. Is there anything you would tell your younger self, like college classes, interviews, or things you would do differently?
I would have I would have studied Spanish, because I would love to be bilingual. I feel like it would help so much with some of the patients that I take care of. So that would be one thing. I really wish I could speak Spanish. I would have studied abroad, even if I had to take out a loan to do it, because I think it would have been an amazing opportunity to be able to provide healthcare in a different country. Yeah, those are probably the biggest things that come to mind. I'm sure I could think of more.
I think we all can at that point. Abigail asks, is extra education needed to be a PRN navigator?
So the PRN piece, the APRN.
Uh-huh.
So the APRN stands for Advanced Practice Registered Nurse. So the job that I have was not a designated, had to be a nurse practitioner, but it was an advanced practice degree nurse. So it was somebody with at least a master's degree or higher. And that could have been a master's degree in other things like, public health or policy or leadership or something. But mine was, in nurse practitioner.
Let's see. There was a really great question. I think a couple people really wanted to hear about how do you have a conversation with someone that's being abused? How do you start that conversation?
Yeah, those are difficult. We try to normalize a lot of the questions we ask in healthcare, so that we're not pointing certain patients out for certain things. So we overall ask patients a lot of questions about their safety and whether they feel safe and do they have a safe place to live. So those are all normal questions that we get really comfortable asking, because we ask every patient who's admitted to a unit or who comes in these same questions. And sometimes the answer no, even when you may have a hunch that something's going on. And so typically what I find is, not pushing things with patients, but allowing a relationship to develop. And once a patient feels comfortable and safe and that they can have a conversation with you is usually when you start to find out more information. And so, we ask all patients questions. We don't push, but we also can, you ask open-ended questions. Oh my gosh, those bruises, how did you get those bruises? And you kind of try to peel back the layers of the onion as much as you can, but you also have to respect the patient, and be willing to, not push when they're not ready to disclose certain things.
Great. What's the hardest part about being a nurse?
I think sometimes, there's like caregiver fatigue where we take care of others, we provide for others, we're always worried about other people's health, where sometimes maybe we don't do the best taking care of ourselves. I see that across the board. I think in healthcare providers that we tend to be givers and often neglectful of our own needs. And so I think that that's sometimes the hardest. I may be a little less with my children and my husband. You're not dying, you're fine, like you're going to school, it's okay, you're not bleeding. So I'm probably less empathetic with them than I am with my patients. But
would you recommend going, if you're going for your RN, going straight into a 4-year or going to the 2 for your associates and transitioning into the BSN?
So once again, I think that's a very, it's dependent on your personal situation. I would say sometimes it's quicker to do the bachelor's degree 4-year right off the bat. If you're able to, mainly because what we see sometimes with the associate's degree programs is that there's waiting list, and there's waiting list for clinical rotations. So sometimes you may be finished your classwork or your coursework, but you can't start your clinicals because there's not an opening. And so I've heard and seen of some nurses getting an associate's degree that took longer than a 4-year bachelor's degree. And then at the end of that, they still have to go on and get their bachelor's if they wanted to become a nurse practitioner. So it depends on your situation completely, but if you're able to, I would go for the bachelor's right away.
What happens if you fail to meet the recert requirements after becoming an NP?
Oh my goodness. I don't even want to think about that. I mean, you know what they are. Like you have to know what your recertification requirements are. Most of it is based on your continuing education, and making sure that you're doing that and not waiting to the last minute. There are, I think, some contingencies on, I think you can apply for like a short-term contingency. It probably costs a lot more money. Like you have to keep paying. I don't know, but and then a lot of things though, if your license lapsed, like you can't work. So you just have to be very responsible with that part of recert.
I'm looking, Tim. We have
and when I say continuing education, that does not mean like college work. That means medical education. So a lot of times you can read a journal article and complete the test at the end and get an hour of continuing education. You attend a conference. There's a lot of free continuing education that's offered in our state, and through different organizations. Like I'm part of, the American Academy of Nurse Practitioners, and they send free continuing education, and Sigma Theta Tau. I mean, there's just different ways to get that.
And this is probably just a recap because I remember you mentioning this. Do you have to have your bachelor's in nursing in order to become an NP?
No, you do not have to have a bachelor's in nursing. There may be some prerequisites that if you have a different bachelor's that you don't have, there are certain, there's like a statistics course that you have to have before you can become a nurse practitioner. There's a couple just like a chemistry, like there's certain ones. So obviously if you were in the sciences, it's going to be easier for things to transfer over. But you just need to have a bachelor's degree, and then the program would let you know what other courses, what other prereqs you still need.
Okay, just a quick answer a question. If you all are logged on right now and you see with your name anonymous user, please send an email to tgibbs@delamed.org. I'll drop that into the chat. Or Christy, would you drop that into the chat for me, please? The answer to how do we know attendance, assuming you registered through Zoom, Zoom knows it's you when you come back in. And that's how we let Zoom take attendance for us. it doesn't work very well for telephone numbers. What is the difference between an APC and a PA?
APC.
Yeah,
I'm not sure.
advanced practice. I think they probably mean an APRN.
Okay.
Yeah.
I think we touched on that one
Yeah.
earlier. It's just a different way of, it's a different program, different education. We practice very similar and we work in similar environments, but how we get there is different.
Right, right. How does high school achievements, SAT, GPA, translate into scholarships for upcoming medical professionals, including nurses?
Well, I graduated in 2000 from high school, so things are probably a little different. When I graduated, I've always enjoyed school to a point and done pretty good in school. So I was able to get what we used to have in Delaware was called the MBNA scholarship. And they used to cover quite a bit to go to a Delaware school, and that's not available anymore. But also I recommend like applying for little scholarships. I remember getting, $50 here, $100 there, and that helps. That really everything little bit helps. And I applied for scholarships even through my doctorate program. I received 3 different scholarships from organizations. I received a scholarship through the Delaware Nurse Leader Organization, the Village Improvement Association. It's a women's group that gives money for people in healthcare. I mean, just look and like Google and check in with hospitals, see if they provide anything. There are scholarships available, and it's worth sending the application in just to see if you can get some support.
Christy, do you want to ask one of those 2 remaining questions? I'm trying to go back and find a question that I know I dropped.
Sure. Any advice about doing overseas medical relief as an RN or working in agencies such as Indian Health Services?
I don't think I can really answer that because it's not something that I have experience in.
Yeah.
Yeah, I'll give it a shot. There are structured ongoing programs, and then there are emergency relief programs. Like several years ago with Hurricane Maria or the Haiti earthquake, and there will be special missions where they'll get a bunch of medical professionals of all types to go down with supplies, be they surgical or antibiotics or whatever, to help the local population, medically bounce back. The medical missions, if you will, are very spontaneous. And I won't lie, there is a little bit of risk associated with them, because usually you're going into an area where there's been some sort of a natural disaster or, a human disaster, if you will. The more scheduled routine medical missions are almost like a student exchange program. And I think if you Google that, you probably find a good deal of information. But for right now, the big focus would be on getting your high school education done, getting into undergrad. And I think that Carrie gave a really good piece of advice. If English is your primary language and you are going to be working in or know you want to work with the language population different from English, get going on it now. The older we get, the more difficult it is to pick up a new language. Trust me. Let's see. I cannot find whatever the other question was. And a high school junior volunteer in a hospital as PCT in junior year. Shamer, what's PCT?
Patient care tech, I think is.
Oh, okay.
So that I'm not sure of, honestly. There are we at BB For example, we usually have people that are in charge of kind of the volunteer program, and we have people that are in charge of any shadowing opportunities. So I don't know what the current rules and COVID changed a lot of things, and then there's a lot of policies because you have to have certain requirements before you can come in the hospital. So you can reach out to the education department of any healthcare system, and they should be able to help answer that.
Right. And there's another program that Christy and I are working on, which is for community health workers. And community health workers can be, I would say a sure bet would be 18 years old. It might actually be younger than that and 16 years old. Legislation next year will tell. But community health worker is they've been around for a long time, but they've gotten a lot of visibility recently, in particular through the pandemic, and the fact that there are people who are members of the community who aren't getting advanced degrees, but they're learning how to be, well, you can call them a lot of things: health navigators, promotora, public health field workers. There are a lot of different names for it, but there are types of that whole new class of people who you could get your certification as long as you were, at least I would say 16 or 17 years old, and feel pretty confident that there'll be a place for you somewhere. Sorry, that was very shooting from the hip.
I did look up the requirements, and it looks like you have to be 18 for a patient care tech. And the person that put that question in, I did put a link to what some of those requirements in Delaware are for a PCT.
Great. And oh my gosh, I'm not even going to try and pronounce your first name, but the question is, we don't have to do anything for attendance as long as we join and stay throughout, and the answer is yes. After you said your first name to me a couple of times, I'll be able to say it myself. The recording of tonight's meeting will show up next week on DelawareMiniMed.org website. And is there any Community Health Worker Association present in the state? Yes, there is, the Community Health Worker Association of Delaware. Emily asked, what colleges can I go to be an NP? Emily, if you Google that, you'll get your answer. Realize that the answer that you get right now will be different when you actually get to the point where you're getting your NP. As Carrie said, the landscape has changed a lot. And Carrie, just as a point of order, there weren't electronic calculators when I was back doing that thing, and I mean that like literally. So date myself. One of the other questions that's from Jessica's remaining here, which isn't about tonight's topic, but if you attended Mini-Med North but didn't do all sessions, and you missed one in North and you made it up in South, or you do the whole South series, yes, those combine together. They come in blocks of 6. After you do 6, you do a reflection paper. The attending 6 gets you the signed certificate. Doing the reflection paper gets you eligibility to be a member of the Delaware Youth Medical Academy. So once the signed certificate, the next is the Youth Medical Academy. If you attend a total of 18 points, in other words, 3 6-week series, then you're eligible to be our guest to the annual meeting of the Academy, and we'll recognize you there. So that's how all of that works out. Carrie, thank you. Christy, what do we have next week?
Next week, you hit me. I'm not sure. I have to look at the schedule. What is next week?
Aaron.
Oh, Taryn, we have pediatric nursing.
Yep.
Next week. We do.
Pediatric nursing. And to my colleagues, Kate Smith, who I have been repping for this whole thing with her name and whatnot, and periodically when I stop my Camera being Kate Smith. Dr. Smith, I apologize. I don't know how I hijacked your account. Carrie, thank you very much for joining us. Everyone have a fantastic Thanksgiving. We'll see you next week. Good night.